Wonderful. Welcome again. Buenas noches. Buenas tardes. My name is Minerva Romero Arenas. I'm a general and endocrine surgeon at Weill Cornell Medicine, New York Presbyterian Brooklyn Methodist Hospital. And on behalf of the Latino Surgical Society, it's my pleasure to welcome you to our Inside the Operating Room webinar featuring Dr. George Molina, who's a dear friend and colleague. The Latino Surgical Society was established to cultivate, nurture, and support the advancements of Latino surgeons. We would like to thank our institutional members, including our platinum members, the University of Washington, Seattle, Emory University School of Medicine, the Medical College of Wisconsin, our gold members, Yale University School of Medicine, our silver institutional members, the University of California, San Francisco, and University of Texas at Austin, as well as all our bronze members, including Massachusetts General Hospital, Morehouse School of Medicine, University of Alabama at Birmingham, the University of Florida at Jacksonville, and our institutional members, including Oregon Health and Sciences University, Harbor UCLA Medical Center, Penn State Health, Houston Methodist Hospital, Penn State Health at Hershey Medical Center, and the University of Louisville. I also want to take the opportunity to thank our Inside the Operating Room co-director, Dr. Ana Sofia Ore Carranza and Dr. Rick Favorita. So with that in mind, I invite you to join us, move forward together with the Latino Surgical Society. And I will take the opportunity to introduce our speaker and our guest moderator now. Tonight, I have the pleasure of welcoming Dr. George Molina for the 15th installment of our series. Dr. Molina is a hepatopancreatic biliary surgical oncologist at Dana-Farber Brigham and Women's Cancer Center. His parents are from El Salvador, and he was born and raised in South Florida. He attended Johns Hopkins University and then Harvard Medical School. He obtained a Master's of Public Health from the Harvard T. Chan School of Public Health during his medical school education. He then completed a residency in general surgery at the Massachusetts General Hospital and a fellowship in complex general surgical oncology at the Mass General Brigham Dana-Farber program at Harvard Medical School. In addition to being busy with his clinical practice, he's actively building a health services and health system innovation research program. He's currently funded through a KL2 award from the NIH and through the Harvard Catalyst Harvard Clinical and Translational Science Center. His work focuses on improving access to complex care and making surgery safer in the operating room. He's a core research faculty at the Center of Surgery and Public Health and Ariadne Lab, both at Brigham and Women's Hospital, and the latter is also affiliated with the Harvard School of Public Health. Dr. Molina is married to Dr. Rose Molina, who is an OBGYN at the Beth Israel Deaconess Medical Center in Boston, which is also one of the Harvard teaching hospitals. They have a 2.5-year-old son who keeps them active when they're not in the hospital taking care of patients. Welcome, Dr. Molina. Thank you so much for joining us today. I also want to introduce our moderating resident who is joining us for the 15th installment. And I want to welcome Dr. Numa Perez, who is a general surgery chief resident at the Massachusetts General Hospital. He is on his 5th and final year, last clinical year. He grew up in El Salvador until the age of 17 when he migrated to the United States. Upon arrival, Dr. Perez joined the U.S. Marine Corps and served in Afghanistan as part of Operation Enduring Freedom 4. After the time served in the Marines, he obtained his degree in electrical engineering from the University of California, Berkeley, and went on to attend medical school at Harvard Medical School. During his residency, Dr. Perez took time off for research, focusing on a wide range of topics, including pediatric obesity and the treatment of this disease, access to care for racial and ethnic minorities, and mobile healthcare technologies such as mHealth. Outside of work, Dr. Perez enjoys spending time with his wife and his 3 children. And after completing his surgical residency this summer, he will be heading to Cincinnati to complete a fellowship in pediatric surgery at the Cincinnati Children's Hospital. Welcome both, Dr. Perez, Dr. Molina. I'm going to go ahead and turn it over for the Salvadorian fiesta.
Well, thank you very much, Dr. Romero Arenas, and thank you to the Latino Surgical Society for this great honor. Not only is it an honor to just moderate any webinar for LSS, especially the inside the operating room, but it's especially, you know, an honor for me to moderate this with my colleague, Dr. Molina, who is somebody I've looked up to, you know, ever since I was a first-year medical student at med school. So thank you for having me, and we'll get right into it. So, Dr. Molina, you know, why don't we start by hearing a little bit more about your background? You know, where do you come from? We heard a little bit in the intro, but tell us more, and you know, why did you choose a career in medicine?
Sure. Thank you, Dr. Perez. It's an honor to be here with you. We've known each other for a long time, and it's amazing to see how successful you've been, and also all of your future accomplishments. So thank you for being here and for doing this. So my parents came from El Salvador in the 1980s, and there was a pretty terrible civil war happening at that time, and my parents left. My dad is one of 12, and he tells me that they left 2 by 2. So there were 12 siblings, and 2 at a time they were leaving the country. My dad is number 5 in line. And this was, you know, not by their choice. I mean, they were farmers, very happy. They were successful in their own means. You know, they didn't have a chance to have a formal education in El Salvador, but that was just kind of the you know, the culture at the time, but they were very happy. So they came to the U.S. and here they struggled and worked really hard. My parents finally made it down to Florida. I was born there, was raised there, and I was raised in a very loving, nurturing family. My dad is one of 12. My mom is one of 5. I have 50 plus cousins. So it's a big, big family. And the gatherings are always at my house. All of our holiday gatherings, Thanksgiving, 4th of July, Christmas, are always at my dad's house. So I grew up around a lot of people, and it was just a very close-knit environment. I knew from a young age that I wanted to be a doctor. I don't know why. My parents told me that I had a Cuban pediatrician in South Florida, and that I told him when I was like 5 or something that I wanted to be a doctor. And my pediatrician said, "Oh, son, by the time you're old enough to become a doctor, there won't be any need for doctors." And I got really upset. I started crying, and I went home and I said, "I want to be a doctor," and blah, 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 this and that. So for some reason, it just kind of stuck. And in high school, when I started kind of really thinking about college, I you know, started doing all the requirements and trying to be competitive for college. And I heard of Johns Hopkins University, and I was told that this is the mecca for pre-meds. You have to go to Johns Hopkins if you want to become a doctor. So, you know, I made it my thing, and I applied early decision and convinced my parents that I should go to Johns Hopkins, and I did. And I think that's where I really realized what it meant to be pre-med, what it meant to actually become a doctor. I went to public schools, and I'm proud of my education, but I was never challenged. You know, I kind of cruised along until junior, senior year when I started taking AP classes, but I really just cruised along. It was at Hopkins that I, you know, got my, you know, first B-, right? That I was like, wow, this is, you know, how can this be? And I called my parents upset and all this stuff. But I think that's where I really got my formal, you know, my training in how to study, how to really take all of this seriously. Leaving home was difficult, you know, because I was in the middle of the pack of my cousins. You know, we're many cousins, but I was kind of in the middle of my age group. And I was the first one to go to 4-year university, and I was the first one to leave home. Nobody had done this before. So it was kind of bittersweet for my parents. You know, my dad, I think, had it the hardest at first. You know, my dad and his brothers and sisters own and operate restaurants. So they've been very successful. They're Mexican Cuban restaurants. You know, that was the thing back then, right? They learned how to cook Mexican food, and
But
Salvadoran
they
food.
sell pupusas, though, right? They
They
sell
don't.
pupusas.
No, they don't. Yeah. Yeah,
Oh,
Salvadoran food was never a thing in South Florida, it just until now, right?
that is
Um,
true. Yeah.
so yeah, so I think my dad always had a dream, a vision that I would, be part of the business and kind of help out. And I did. I worked since I was 11 years old at the restaurant business, but I always knew that I wanted to become a doctor. So leaving home was bittersweet, but my parents understood and were very supportive. So I've known for a long time that I wanted to be a doctor, and I always had inklings that wanted to do surgery, and that really didn't click until later years of college and definitely in medical school when I realized I really love to work with my hands and I want to be a surgeon. So kind of a long-winded story, but my roots are in South Florida. I definitely have strong roots in El Salvador. But if you ask me, where am I from, right? I'm from South Florida. I love El Salvador. I've been back, but when I go there, I feel somewhat like a stranger, right? Like I feel like a foreigner a little bit. But I
Right.
definitely have strong ties to El Salvador and through my parents and family.
Right. It's an amazing journey, and it's a journey that I think it has touched and touches a lot of immigrants. Whether you're generation zero or first generation, or I think a lot of immigrants from Latin America, either have parents or at most grandparents, or we ourselves, migrated. And the story of the migrant is always very near and dear to our hearts and to what we do and how we behave and how we work. Let me ask you, you touched a little bit on the sort of feeling that you had when you got to Hopkins, and it almost like you were finally a small fish in a big pond, where before you were a big fish in a small pond.
Yeah.
How did you handle that challenge, and sort of, you mentioned talking, calling your parents, and how did they support, allowed you to refocus and to say, what, that's fine. A B- is not the end of the world. I'm just going to work harder. This is not high school anymore. I'm not going to cruise here anymore. Like, how did you, face that challenge? Because you could have just dropped out, right? Like, you could have just gone back to South Florida and been like, yeah, Johns Hopkins wasn't for me.
Right.
I'm back at, my state university or something. How did
Yeah.
you approach
Yeah. I think the hardest time in my education and adulthood was in college for everything that you're mentioning, right? So my first round of midterms at Hopkins, I got a couple of A's, but a lot of B's and B minuses, right? And I never gotten a B minus or a B in class, right? So I call my parents, I call my dad, and they're very supportive, and my dad is like, listen, son, what you've done thus far is amazing. We're all so proud of you. You got into Johns Hopkins. If you want to come home now, it's fine. Come home. It's okay, right? I see that you're stressed out. I see that this is too hard. We can't help you. So just come back. Just come back, right? We'll support you in what you decide, but you're welcome to come back and don't feel like a failure. And I got really upset. I was
that?
I was like, Dad, I want you to push me instead, like I want you to say, no, that's not good enough, and he was like, I'll support you in whatever you do. And obviously, he supported me in staying. But I think what made college hard was not only the coursework, but it was the fact that I was away from home, right? So I grew up with my cousins. My cousins were my brothers. And I got home from school and I had my sisters there. Cousins would come over on the weekends, right? I was at the restaurant. I saw family, friends. My family is huge. I have first cousins, second cousins, third cousins. It's just a big family, and I missed that connection. I really missed having that environment. Everything could be going bad at school, or I played soccer. I could have lost a bad game, but when I got home to my family, everything was fine. I did have family in Baltimore. There was like a second or third cousin of my dad in Baltimore, so they were really helpful. But they were like 30-40 minutes away, and having them there was amazing. They're four brothers and a sister, and one of the brothers became like my friend. He's like maybe less than a decade older than me, but he was like young and hip, and he would like take me to places when I was down and stuff. So that was nice. But it wasn't my parents, it wasn't my sisters or my first cousins, right? That I had, grown up with. So that was hard. So I gravitated towards the Latino community at Hopkins. There was this organization called OLE, Organización Latina Estudiantil. So I gravitated towards them, and I met a lot of great people there. My best man on my wedding, Joaquin Camara, is now a neurosurgeon specializing in spine at Brown. He became one of my closest friends, right? So I relied on people. And I also realized that I had to learn how to study, right? Like I had to, learn how to, actually do the work, right? When before it was really easy.
Right.
And then my faith. I was raised Catholic, so I really, stuck with my faith, went to church, and really, try to have something greater than me, right? Support me at times when I knew, when maybe I was self-conscious that I couldn't do as well as my peers, that I didn't go to a fancy private school, that this and that. And my parents, they were never, they never had high academic expectations. It's kind of, I'm not sure your experience, Numa, but my parents never were formally educated, right? So my dad went to like second grade, my mom third grade, right? The culture was very different. So my dad never expected good grades. He expected us to work. So the expectation was to work at the restaurant business, right? That was his thing, work ethic. But it was never academic success, So for me, that academic success drive had to come from my teachers and then internally. Like I had to push myself. Like that was my own. So sometimes I would be hard on myself because my parents were never hard on me on, my grades or stuff. But they were always very supportive. So having my parents support me was really, beyond anything I could ask for. They never were in a lecture hall or in a classroom. They never took a test. But my mom and dad always had the right thing to say, except for that one time when my dad said, "Come home," But other than that, my parents always knew what to say. They knew how to support me when I was down or whatever. And I think maybe if my parents, were of the type that they had all these high expectations academically, maybe I would have, maybe I would have dropped out, right? Maybe. But my parents were the opposite.
Right. I mean, it's amazing. For all we know, by the way, maybe your dad was just testing you. Maybe if you would have said, "Okay, Dad, I'm on my way," he would have said, "Absolutely not. That was a test and you failed. Straighten up, son. I didn't raise you like this." But you did allude to something, right? And again, back to the story of the migrant, right? Like your parents might have not had great academic expectations, but they expected you and your siblings and your cousins to work hard.
Definitely.
And I'm sure that sort of work ethic, that philosophy has come a long way in surgery because
definitely.
you work hard, So let me ask you, along that journey, right? So you always wanted to be a doctor.
Yeah.
When did you start playing with the idea of, oh, maybe I want to be a surgeon, not a pediatrician like my Cuban pediatrician, but actually a surgeon?
Right.
And then, when did surgical oncology become an interest of yours?
Yeah. So it was interesting. I in high school, I became really passionate about HIV. I would see, news stuff from Latin America and how, the HIV epidemic was affecting poor people, and there was still a lot of stigma. And there are a lot of things that I kind of experienced or read that really got me into HIV. So in college, I did a lot of biophysics research on HIV. I studied protease inhibitors and their affinity for the enzyme protease. Mm-hmm. And I did a lot. I loved it. I rotation at the psychiatric unit at Hopkins for patients that had dual diagnoses, psychiatric disorder and HIV diagnosis, for example. And I was so immersed in this. And then somewhere around junior year or so, it hit me. I can't do surgery if I do infectious diseases. And I got like really depressed and down, right? I was like, okay, this is fine. I was doing community work and HIV with the American Red Cross. I was doing my research. But then my good friend, Joaquin, always knew he wanted to do neurosurgery. From day one in convocation, when him and I met at Hopkins, right? The question you asked was, oh, what kind of doctor do you want to be? Everybody was pre-med, right? So, we asked ourselves as freshman convocation, right? And he's like, I want to do neurosurgery. And I kind of laughed or whatever. I was like, yeah, sure. And, but at that time, Johns Hopkins, the Department of Neurosurgery, was recruiting Alfredo Quiñones. And Joaquin, my friend, had done research with Dr. Quiñones. Dr. Quinones went to UCSF. His story is one of those stories that like makes you really kind of, I mean, I think we all know his story. A lot of people know his story, right?
His
Immigrant
book
from
is amazing.
Mexico, brilliant. And now as a neurosurgeon, the chair of neurosurgery, I think down at Mayo in Jacksonville.
I think
Anyhow, he was, I'm sorry?
I think so. Yeah.
Yeah. So he was being recruited to Hopkins, and they recruited him. And Joaquin was like, "Oh, come, we'll have dinner with him." And we had dinner with him, and I met him, and he was just so inspiring. So that was my first kind of like instinct. I want to do surgery seriously, and I actually want to do neurosurgery. So I went on this stint of I want to do neurosurgery. So I come to Harvard School. I'm still in this stint. I want to do neurosurgery. I spent the summer before medical school doing this program for medical students that were underrepresented in medicine through Harvard. And I was in Dr. Peter Black's lab here at the Brigham, who's a neurosurgeon, who's the chair or chief of neurosurgery at Brigham and Women's Hospital, where I'm now faculty. So I knew it. I was like, I'm going to do neurosurgery. First year, I do some shadowing, and I just don't like it. It's like very confined, right? It's like very like, minute, like miniature surgery and stuff. And I'm like, I just don't like it. And then I was like, you know what? I love general surgery. And in medical school, I was like, I'm gonna do something in general surgery. I then met a few people here and there that kind of sparked my interest in research, but then it wasn't until I did my 4th year rotation. This was my 5th year medical school, but the year after my MPH, I was doing my sub-Is, and I did the sub-I on the pancreas service at MGH, at Mass General Hospital. And I met Dr. Carlos Fernandez del Castillo, and just blew me away. I was just like blown away, right? Like the guy is like, amazing with patients, amazing teacher in the OR, outside the OR, technically superb, loved by everybody. And I fell in love with the pancreas. I was like, I'm going to be a pancreatic surgeon. I fell in love with the Whipple. I was like, the longer, the better, right?
And Dr. Fernandez was the inaugural speaker of this series, of the Inside the Operating Room. Yeah, amazing.
Right. Yeah, that's right. So I think that's when I realized I want to do. At that point in time, HPB fellowship was still pretty popular. So I went into residency thinking maybe surgical oncology or HPB. And then I gravitated towards surgical oncology because I felt like, the advice was you're maybe more marketable. You can do a lot of stuff, getting an HPB job may not be possible when you graduate, right? So you could do a lot of stuff. So, but it was really Dr. Fernandez del Castillo that kind of put that seed that made me interested in surgical oncology.
That's amazing. Your story, and I've known you for a long time, and I didn't know that you came into medicine thinking neurosurgery. And the funny thing is, I came to medicine thinking neurosurgery. So I don't know if it must be some kind of Salvadorian thing that we're just obsessed with brain surgery or something. We watch TV, who knows? But that is interesting. Now, so you mentioned meeting Dr. Quinones and having that be really impactful. We've obviously heard a lot about your dad and how much of an impact he's had in your family. You just told us a little bit about Dr. Fernandez, but maybe can you tell us more in a focused manner, sort of who have your role models been, both growing up, but also now as an adult, as a surgeon, like who have your role models been? And why? What were the things that made you look up to them specifically?
Yeah, I think my as might be obvious, my first role model was my dad. I think he has overcome quite a bit, despite not having a formal education like you or me or a lot of us in this webinar. He's brilliant, just a really smart guy, and he's been very successful in business. And because of his success as a restaurant owner, he supported me financially to go to college, medical school, and MPH. So I've been, I'm very much a son of immigrants. And, if you were to meet my family, we are immigrants, right? We live like immigrants, we act like immigrants, right? It just is immigrant feel, right? But there was a point in time where my dad was very successful, and he's been very successful. And that drive, his ambition, his drive, his ability to navigate complex situations, right? Despite all his limitations, that for me was like, wow, like he's always been my role model. And until this day, he is my advisor, right? Anything complex, doesn't matter if it's whatever it is, he knows what to do, right? I explained just enough for him to understand, and he says, I think you should consider this, right? And so he's always been my role model, and continues being that role model for me. And then throughout life, I think I've met a number of people. In college, I was in a lab, like I said, in the biophysics lab. The director of the lab was not the PI, but the director. His name was Arnie Schoen. And he just took this huge interest in me, right? Taught me how to do the research. I applied for a few grants. And that's when I realized that science was something that I wanted to do. In medical school, I met a lot of great people. And it wasn't until I met Dr. Atul Gawande. I had read about him, right? I read his books, and but it was a paper that I picked up that told me or sparked an interest right to him. So I was about to start my MPH. I wrote to him. He wrote a paper that was published in Lancet on the 5 surgical vital statistics. And these were things that him and his fellows said, we should be measuring these 5 metrics around the world. And I emailed him and said, hey, I want to do this in El Salvador. I met him. He took me seriously, paired me up with one of his fellows, Luke Funk, who is a Brigham resident doing research with a tool. Now Luke is a bariatric surgeon in Wisconsin. And Luke Funk also took me seriously. Got funding through Harvard Medical School, went to El Salvador for 9 weeks. I visited all the major hospitals, collected these 5 surgical vital statistics, published it with my first publication. And I was a part of their group. During that time, I met briefly Alex Haynes, but very briefly, I met Alex Haynes. He too was a fellow doing research with Atul Gawande. He was an MGH resident, and he was an outgoing chief at MGH when I was an incoming intern. So we never really overlapped at MGH. And then in residency, I knew I wanted to do research again with Atul Gawande. I emailed him, and he's like, oh, listen, I'm actually creating a lab. It was the Atul Gawande research team, right, with fellows, and now it was becoming Ariadne Labs. And he's like, by the way, I'm recruiting Alex Haynes back. You know Alex Haynes? Oh, yeah, I met him a few times. He's like, I want you to work with Alex Haynes. So I met with Alex Haynes, and he took me under his wing. And Alex Haynes, probably one of the best mentors, right? Atul Gawande, Quinones, they were mentors, but more like sponsors and, like advocates, right? And Luke Funk, I worked with them for about a year or so, fantastic. But Alex Haynes was the one that I really have worked the most with, and really pushed me hard, right, on how to write better, how to, think critically. And I spent 2 years of research with him. And it was just phenomenal. And I think has really shaped, how I look at research, what kind of questions I ask. I still seek his counsel and mentorship now. Now he's a vice chair at Dell, really successful. So, and then, but I've kept in touch with all of these people. Atul Gawande still is a huge sponsor of mine, right? I probably have the job that I have at Brigham because of Atul Gawande, right? Picking up the phone or saying yes, you should take this guy. So he was, all these people have really played a huge role in my life. And then I knew Dr. Fernandez in medical school, likewise, huge advocate, sponsored throughout residency. I went to MGH because of Dr. Fernandez. I wanted to be trained by him, and I learned so much from him. He really has shaped me as a surgeon, and especially as a pancreas surgeon. And then I met other people, Motes Gadan, who you work with at MGH, right? Phenomenal surgeon. And likewise took me under his wing, right? Motes Gadan is one of those rare surgeons that straight out of fellowship, the guy was known by everybody, right? Just has his ability to work a room and kind of speak to people in a very positive way. And I learned so much from him. And I remember him telling me when I was a fellow, I think it was a chief resident or fellow, he was like, we were at I think ACS or a major meeting. He's like, just stick with me, just stick by me. And I did. He introduced me to all these people, right? This is George Molina, he's a stellar fellow. He's gonna be applying for jobs soon. And And I think having that kind of mentorship and validation really meant a lot. And you know, and along the way you keep meeting people, but I think those are probably, I'm sure I'm missing people right now, but those are probably kind of the big people that I think have played a huge role in my life, you know, and especially as an academic surgeon.
Let me ask you a question related to that, you know, because when you go to talks like this, to webinars like this, invariably the word mentorship comes up a lot for good reason, right? Because it's incredibly important. But what is harder, especially when you're younger, not in age in my case, but in stage of life, you know, what is hard is, well, how do I find a mentor? Like, you know, it's like everyone talks about mentorship and my mentor and my sponsor. And if it wouldn't be for my mentors, I wouldn't be here. But then you go out and you're like, how do I find a mentor? How do I identify the right mentor for me, you know? And then when I find a mentor, how do I become a good mentee, right? Because you also have to do your part of the work. So can you tell, now that you've been on sort of both sides of the spectrum, how should a med student or resident, you know, identify a good mentor, and how do you keep your end of the bargain for that mentor as well?
Yeah, you know, it's a great question. I would say you need multiple mentors. You need mentors for a lot of stuff, life, you know, research, in your training, and I think you have to sometimes come out of your shell and just email people, you know, email them to meet up for advice. Nowadays with Zoom, and you know, you could do that so easily, right? Before it was a little bit harder. You actually had to meet with that person in their office, you know, and find a time that you could both, you know, be there. Now on Zoom, you can meet them anywhere. But I would say get out of your shell, write to people. I have a policy, anybody who writes to me and wants to meet, I can give anybody 30 minutes of my time, right? And anybody who writes and says they want to meet with me, I'm happy to do so. Not everybody has that, right? We have, you know, job commitments, research commitments, or families. But I think first is just get out of your shell, write to people, tell them who you are. I think we all want to give back, you know, because we've all, you know, we're all here because of people that have mentored us. I think the word mentor is kind of, you know, it might be overused sometimes, right? I would think of, you know, people as people that you seek advice from, mentorship possibly, right? Counsel, right? And you're going to be at various stages, right? You know, if you're applying to medical school, somebody can review your personal statement or give you advice about how to become competitive. You're applying to residency, you're applying to fellowship, et cetera. And then, you know, look for people that may not look like you, right? So, you know, a lot of us, and me especially, I do gravitate to people that look like me, right? But I think some of my best mentors do not look like me, do not have my background at all, you know, and I think you just have to show that interest. How to be a good mentee? If you're gonna say you're gonna be somewhere, be there early. I think now that I'm on this side, mentees that write me emails with updates is really nice, right? And saying, hey, I just want to let you know, I'm in my second year of residency, things are going great, we'd love to meet with you to, you know, 30 minutes to chat. So, you know, updating them, letting them know how you're doing. If you're going to ask for favors, right? Because we all need favors, letters of recommendation, we think things to be reviewed, give them enough time. You know, sometimes I would be really anxious that I want to have, you know, the perfect draft of this, you know, and no, you just got to kind of get out of your comfort zone. And instead, if you're not able to get that perfect draft in time, send it earlier and say, hey, you know, I apologize, this is not great, but would love to, you know, just get your thoughts on this. But I would also just, you know, cast a broad net here. So, because in life, you're going to need sponsors, you're going to need advocates, you're going to need mentors. When you're applying, when you're trying to be promoted, right? You're going to need letters from people that are outside of your institution, right? How do you meet those people? Well, it's to do this, right? If you come across them at conferences, if they're in town giving a talk, I would go up after their talk and ask them a question or talk to them and, you know, introduce yourself. So it's not perfect, right? And I think, you know, you're probably going to have a lot more shots than what actually goes in. But I would say keep trying.
Right. No, I mean, that's great advice, and I think you're probably even more familiar with this story, but Dr. Fernandez's story of how he got to MGH, right? Which I think he sent letters, because back in those days it was letters, not emails,
Right.
to I can't remember how many people, and one person replied, right? That was Dr. Warshaw.
That's right.
And then the rest is history. So I think the point that you make of like, you have to come out of your shell and just reach out to people, and you might get shot down 90% of the time, but all it takes is one person to give you 30 minutes, and there you go.
That's right.
Now, you mentioned, not every mentor is going to look like you, right? And obviously, the entire purpose of Latino Surgical Society is, to promote the advancement and the success of Latino surgeons, right? And people who look like us, or minorities in general, right? And on that note, being a minority, or you or I am underrepresented in medicine, or having any sort of minority identity or minoritized identity, right, comes with a price, right? It comes with obstacles, and especially in a journey like medicine or surgery, I'm sure you've experienced a lot of those obstacles, whether related to being Latin or related to coming from, South Florida, coming from an immigrant family. I mean, so can you tell us a little bit about what you would think are your greatest obstacles that you had to face, and how you've faced them, and how you would advise people who maybe are experiencing similar obstacles in residency, in med school, whatever it may be, how they can get over that?
Yeah, it's a really interesting question. I've thought about this a little bit, throughout the years, and I think my biggest obstacle has been me. And it's this it's and what I mean by that is, I've always had this feeling that what I have can be taken very easily, right? So that mentality that what you have is almost like, easily taken from you, that what you have is by luck, right? You're only here because of luck. That mentality can sometimes make you just put your head down and just work hard and try to move forward, but you don't advocate for yourself. Sometimes you don't speak up, right? You don't complain, because if you complain, right, the only Salvadoran in the program is complaining, we're going to kick him out, right? But this was all internal. This was like me internalizing, the immigrant experience, right? That we're here because of luck, that we're here, my parents, they became residents because my dad had an employer who was really kind and generous and said, hey, Miguel, I want to, make sure that you're here legally, right? And not, being deported. You have a son and a wife and children. My son is coming up, by the way, up the stairs here. So
nice.
But, it's this mentality of like, what you have can be taken. And I think at times that creates fear, and it creates, being self-conscious and insecure, right? When in actuality, this is my son. I don't know if you can see because of my blurred vision, but in actuality, what's required is to be confident, right? So I think many times the obstacles were self-created, right? Oh, I'm not going to apply to that because I'm not good enough. Or, oh, I shouldn't send that email because that person's not going to write back. Or, oh, blah, et cetera, et cetera, et cetera, right? So I think I've learned how to overcome that, right? I'm going to fail, but it's not because I'm Latino. It's not because I'm the first member of my family to get a college education. It's not because my parents are not educated, because we all fail, right? I may not do the best at this or that, but it's not because I'm not good. It's because I might have to learn, and I think even now as an early career faculty, right, I need to get out of my way. I need to, be ambitious, be confident, right, take risks, and not internalize all these things that we're kind of told, right, that we're lucky to be here, that you're only here because of affirmative action, et cetera, et cetera, et cetera. So I think that has been the greatest obstacle, and I think it's taken a long time for me to overcome that. To really kind of push harder and say, you know what, I can do this. Yes, I will fail, and that's fine. But I should try harder. I should look for those opportunities. I should speak up, right? I should advocate for myself. So yeah, long-winded answer, but I think that's what I would.
It's great advice because you touch on something that, to be honest, I didn't realize that I had this until I read a paper recently, I think a year and a half ago or something like that, about imposter syndrome.
Right.
And you basically, what you were saying is exactly that, right? Is this idea that you're only here by luck, and I never realized I had it until I read that paper, and you're right, it puts you in a different mindset when you fail, which invariably will happen, especially in a career like ours, right? Like, you're gonna do poorly in the OR one day. You're not gonna get the stitch right. You're not gonna, whatever. And the difference is, do you experience that as, of course, because I'm not good enough. I'm just not good. I've always known it. Finally, the charade is over, right? They finally know. Or do you experience it like non-immigrant, people might experience it, which is like, all right, well, that didn't go well. Let me just work a little harder and I'm sure I'll get it, right? And that different mentality can send you on completely different paths, right? One path is self-destructive. The other path builds you up. And it's great to hear you say that, because obviously it's worked for you now. But I think it's something that all of us immigrants have to, first of all, identify that you're having that, and then address it. So it's great to hear that. We have a question here, Dr. Molina, from Daniel Flores, who wants to know what are the things you're doing nowadays to continue to advocate for Latino patients as a surgeon?
Yeah, it's a great question. I am being involved with LSS is something that I've always been very passionate about. Joey Lopez, one of the founders, I've known him for a long time, right? We were like in succession in medical school. It was me, Joey Lopez, and it was you. I think we're like 2 years apart, of each other, right? So
that's right.
Joey Lopez. So, once Joey Lopez told me about this society, I was like, count me in. So, this society always has my support and whatever I can do. And then for my patients, right, I can speak Spanish, so I speak Spanish with them. I advocate for all my patients. As an HPV surgeon, what we do is really complex, and I think the smallest of errors or missing a lab that looks a little bit off on post-op day number 1, and then not realizing until day number 3 or whatever, right? I think it matters, and it all builds up. So I definitely try to advocate for all my patients. For Latinos, though, I think sometimes it can be hard, right? The language is a big barrier. So, and I can't be there all the time. So I always try to make sure that in our hospitals, we usually have a iPop phone or the interpreter, right? And I try to talk to the nurse and say, hey, listen, I'm here rounding on my patients. I can speak the language, but I know that they have needs, right? I mean, right. A patient just doesn't only have needs at 7 a.m. and at 3 p.m. when I round. They have needs, 24 hours a day.
Right.
So how can we guarantee that these patients actually have access to, language concordant care, which is hard, right? And then in the cancer space, specifically, my research deals with how to make access to complex GI cancer care more equitable. We know what the problems are, right? I've contributed to all this literature of showing the problem, but I'm now trying to actually, come up with solutions. And using mentorship, mentors to actually come up with solutions, which I think in the cancer space it really comes down to building better collaborations among hospitals, the cancer centers and the community hospitals, and also making all of this knowledge and complex information more accessible to patients. Could I be doing more for Latino patients? Definitely. I'll be honest, we don't. In Boston, at our hospital, we don't see that many Latino patients, unfortunately. I want to fix that, but I think that's, there's layers and issues that are, much bigger, than what I can, address right now, but definitely would love to see more patients that are Latinos.
Right. Absolutely. I mean, it's a lot of problems, and it's, you do what you can, and you keep at it, chipping away. So that's, it's great to hear that. I want to switch gears a little bit, and I want to hear a little bit more about George Molina, the person, the dad, the husband, the friend, the non-surgeon. What are the things Dr. Molina, that bring you joy outside of work, outside of the operating room? You know, how have you managed to navigate, especially now as an attending, right? Work life, you know, I heard someone say, don't ever call it balance. It's called a work-life juggle, you know?
Yeah.
What are the things that you've done for that? You know, how do you recharge? How do you find joy and fulfillment, especially when, you know, when sometimes things just don't go well at work, you know?
It's hard. It's hard. If you know how to do that, let me know. But it's hard. You know, my wife is also in academics, so we run a pretty tight schedule. We have to know, you know, who's picking up our son from daycare, who's doing drop-offs. When I'm operating, my cases are long cases, right? I'm doing Whipples and whatnot, so you know, I'm not home until late. But having a supportive wife is really important. But I also have to be supportive of her career and you know and what she's doing. So it's a balancing act on that front. Having a host of possible babysitters to help us out, you know, in crunch time. But it's possible. But I agree with you. There's not work-life balance. It's episodic, right? Some weeks are better than others. And then on weekends, I honestly don't do any work, not by choice, to be honest with you, because I just can't, right? There's just so much happening in our house and things that I want to do with my wife and our son, and it's just really hard. But I want to dedicate that time to my family. Outside the hospital, I love to spend time with friends and I love to have my parents over from South Florida. I love to, you know, when I'm feeling down, what picks me up is Mexican food. I was raised in a Mexican restaurant, right? So I you know, if I'm feeling down and my wife is like, "What do you want to go, you know, for dinner this weekend?" It's always Mexican. It just is, you know.
Right.
So I think being outside is great. In Boston, you know, we have a pretty nice spring and summer. So spending time outside with you know, Rose and Rafael, my son, is nice. I like to distract myself with reading stuff that's non-medical and non-surgical. And usually that's like, you know, issues with the economy or finance. Kind of sounds boring, but something very technical that is not surgical, not medical.
Freakonomics.
Exactly. So but yeah, you know, I feel like I'm like any other person that struggles to do my work in the hospital well, do the research. I mentor a lot of residents and fellows doing research, right? So I want to be, you know, be responsive to their needs, but then also responsive to my family's needs.
Right. And it's tough. And I mean, it's good to hear you have found space for that, you know, even in the limited time that we have. I have some more questions from the audience here. So we have an audience member, Dr. Molina, who's asking about, you know, when you approach your mentor, you found a mentor and you approach them, their research interests align with yours, but you yourself don't really have any specific ideas in mind, right? So you're sort of a blank vase, you know, a blank vessel, an empty vessel coming to this mentor. How do you navigate that interaction? How do you get on board with their projects and then develop your own ideas? Or will mentors even take you seriously if you just come and don't have ideas? I mean, how does that even work?
I think you have to read what they're publishing. First of all, you have to know what they're doing. You have to make sure your interests align with what their work is, and then you have to be interested and available to do the work. And that might start off, you know, they might test you. They're not really testing you, but they'll say, okay, you're interested. Okay, do the literature review for this one paper, right? I'm going to pair you up with a resident. Could you do the literature review and write an introduction? Could you help us out with, you know, making figures and tables for this project that, you know, we have all this data for? You know, or, you know, we build, you know, when I started on faculty, I was building our pancreatectomy database. I had a lot of students show interest and say, okay, we need to build this database. Come and help us, right? So I think it's just being available, being interested, but you have to know what they're doing. I don't expect you to have ideas, right? Like, I don't expect you to have complex ideas, but I want you to be interested enough to know what I'm doing and to have, to be able to connect the dots and say, yes, you're doing research in this. And then to have time, right? And I think that, it's hard to say I'm studying for this test, I'm applying for this right now, and I'm working a 9 to 5 job, and I want to do research with you, right? Like it's, like I might say that's a little too much for your plate right now, right? I don't want to put more on your plate. And then I have a personal policy that if I bring people on, I want them to have funding. So usually that's through a program. I want them to be through a program that actually brings funding. Because I think, doing research for no pay is no fun for anybody, right? So most people will bring funding from a program, and there are a lot of programs out there. So I'd be happy if somebody were to reach out to me and say, hey, I'm interested in doing research a year from now, right? Next summer, do you know of any programs I can apply to? I know in many, right? Here you go. Here are all these programs, and I'd even be happy for you to identify me if you want to do research with me.
Right.
Yeah.
Yeah, that's great. That's a great. You got to do the work. You got to do a little bit of work before you meet with that mentor. Read up on them, and then you got to do the work once you.
That's right. That's right.
We got a couple more questions here. I know we're coming up on the hour, but these are very good questions. We got one of our participants, one of our audience members is an IMG, an international medical graduate, and she wants to apply in general surgery and wondering, any advice. Obviously you and I, we had the fortune of, through the efforts of our parents, really, to not have to experience that. But I'm sure you've known people who have been through that process. So any advice you have for IMGs, especially who want to go into general surgery?
Yeah, it's hard, and I think it's a little bit unfair. I think IMGs are judged harder. The expectations are higher. I think you have to do well. You have to do well in whatever you're doing. So whatever you're doing right now, if it's research, if it's studying for your step 1, step 2, you have to do it well. I use the analogy when I have students come to me for advice of a cake. It might not be a great analogy, but there's a cake, right? You go to the store, you see this beautiful cake. It has all this beautiful frosting. You eat the cake and it's a really bad cake. The inside is just not very good, right? The frosting doesn't make the cake, it's the inside. The same thing with your academic career. It's the grades, it's the test scores, right? It's unfortunate, but it is. It's your GPA in college. It's your GPA wherever you go to school. It's your MCAT score. It's the step 1 score. Now it's pass fail, but now it becomes step 2, right?
Right.
So nothing will overcome those scores, unfortunately. They just won't.
Right.
It doesn't matter if you publish phenomenal research, get great letters from wherever it is, you have to have the numbers first. And then once you have the numbers, then everything else is frosting. The papers, the research, the experience, the shadowing, it's all frosting. But you have to have the numbers. You got to do everything you can to be as dedicated and as focused. And sometimes, like what happened to me, you have to rediscover how to learn and study, right? Because we're not taught. Unfortunately, I don't think we're taught on how to study. We're taught material, but we're not taught on actually how to digest all of it. And that is what took me about 6 months to a year in college. I had to learn how I learned, and I never knew how I learned. Like I never had to really rediscover that discover it until college.
Right. Great advice. We'll do one more question, and then we'll go into a fun section of the talk, which is, a lot of rapid fire questions that we'll ask you, and you'll have to tell us the answers at first they come to mind. But we'll do this last question from the audience. We got Diego here who actually is joining us from the UK. So saludos, Diego, desde allá de Inglaterra. He's a first-year medical student, and he was wondering if you have advice, thinking back to when you were a first-year medical student, to get through medical school. What are the tips, the things that you did? You touched a little bit on it, right? Like you had to learn how to study when you were in undergrad. But when you went to med school, what are some tips that you can give to a first-year medical student to do well and then to ultimately make it to surgery?
Yeah, I think it depends where you go to medical school. So Numa, you remember, right? Harvard Medical School, we had this like kind of a funky curriculum,
Yeah.
I went
It's
from
changed now, thankfully, but it was weird then. Yeah.
but you know, I think the old model was rote memorization, right? You had to just read everything, study everything, know it all. And then at Harvard Medical School, it was not the case at all. It was like you did these small classroom discussions, and it was more critical thinking. And so I think you have to know what the expectations are for your medical school and then adjust. And I think you have to become friends with the smartest kids in class. You know, you have to, you got to be pushed by those kids, right? Your classmates.
Right.
You know, I don't know who told me this, but you know, you will never be the smartest one. And if you are, get out of that room. Okay. So, you know, so in medical school, you're going to have people that are brilliant, right?
Right.
Become their friends, right? What are they reading? How are they reading it, right? How are they studying, right? If there's a party going on, there's like a party on a Saturday or Sunday, and everybody's there, look for those that are not there. What are they doing? They're probably studying. It's true, right? So some of us can cruise through undergrad and medical school and through app sites, right? Some of us will get all the great scores all the time. That was not me, and it's not me now. It's never been me, right? I need to take a pause in life. When it came to step 1, step 2, when it came to my boards in general surgery or surgical oncology, I had to take a pause in life. I had to talk to my wife and say, hey, Rose, I need a few months here where I need protected time to study, right? So I think you have to be honest with yourself on what you need. And sometimes going along with the crowd may not suit you, right? Your friends in medical school might be really bright, and they might have, truly photographic memory. They might only have to sit and lecture, right? And read their lecture slides a few times, and that's it. But that may not be you, and it wasn't me. So I think, know what has to be done and do it. And that sometimes will take, we'll require sacrificing, maybe some relationships might require sacrificing, having a good time all the time, I didn't tell you the story about my friend Joaquin, but he's now like one of my best friends, right? He was my best man at my wedding. Him and I clashed first year because he wanted to party all the time. I knew that he not party. I knew it, right? I got a B-, right? And I was studying hard. Okay. So I knew that if I wanted to do well, I actually had to spend time with my friends, but then go back and study. Right. And then it wasn't until second year that he realized the same. And then he was with me at the library, right? Like studying, like we're together studying, right? And that's how we became close. But you just have to make these decisions, and this is a saying that's pretty common and maybe a little cheesy, but you have to pay the price. A price has to be paid, right? This in presidency, this, right? The price has to be paid. You either pay it now through hard work or you'll pay it later. Right. And that later can be really hard, right? You might have a hard time finding a job. You might have a hard time doing your first complex case, right? There's all these things, right? So I think the price has to be paid, and for many, I would advise pay the price now through hard work.
It's interesting because it reminds me of a story when my first undergraduate class at UC Berkeley, after transferring from community college, I was in an amphitheater with 120 people, and I was definitely a small fish in a big pond. And our professor came in and said, 2 or 3 of you here walk on water. The rest of you, just write down everything I write here on the board. You'll get it later. I looked around and I said, I don't walk on water. I started writing. You got to know who you are and do the work. That's right. All righty. Well, we've gotten to the fun.
Let me first just say, I see my sister's on, Anna Garcia. Thank you for being on. She's my older sister. I'm here because of my parents, because of her. So I want to just, do a shout out. So, yeah.
Welcome, familia Molina. Gracias por criar este buen hijo y buen mentor que tengo aquí. All righty, Dr. Molina. To wrap this up, we're going to ask you some questions here, and we need you to just tell us exactly what first comes to mind, okay? No thinking. What's your favorite city?
Boston.
All right.
Yeah.
What is one of your distinctive operating room preferences?
I like to end a hard case with Justin Bieber.
we did not need to know that, but that's okay. That's okay. That's why the rapid fire questions are great. What is your all-time most memorable meal?
Ooh, that's hard, huh? Wow. It has to be from my dad's restaurant. It's called La Bamba. They have a tan piqueña. That is my most memorable meal every time I have it. It's delicious.
Love it. Love it. What's the best advice you've ever received?
Oh, I think when I was telling you about kind of getting out of your own way, that advice, just kind of getting out of your own way. They're not going to take this from you, right? It's too late in the game for them to take this, all of this from you, right?
Right. Right. That's great. What are 3 things you can't live without?
That I can't live without.
That's right.
My family. I think I'd be lost without my family. My wife, my son, my parents, siblings, cousins. It's a lot of people, but I think having them is great. I need to be by good Mexican food. I need to be just by, there has to be some good Mexican food nearby. And then, the last one, I have to see the pancreas like every couple of weeks. I have to.
The pancreas. Good. Yeah, you also can't live without it, but
Yeah, exactly.
I guess you can. You technically can, yeah. What profession other than being a surgeon would you like to attempt?
Being an astrophysicist.
Okay. All right. Neil deGrasse Molina here we have. How do you start your day every day?
By picking up my son, he wakes me up, and I got to go grab him from the other room and bring him into our bed.
That's lovely. That's lovely. And then lastly, what is the best gift that you've ever received?
I would say the ability to go to school without life stressors that my dad gave me.
That is a wonderful gift, and your parents paid a high price. So again, thank you, Familia Molina. And thank you, Dr. Molina. I think this is the end of our session. We'll hand the mic back to Dr. Romero Arenas. Again, great honor, George, to see you succeeding and doing all the things that I hope to do in the future. So thank you for being so candid.
Thank you, Numa. Appreciate it.
And before we finish, I just want to thank you both, Dr. Molina and Dr. Perez, for joining us for this 15th installment. I think the audience has enjoyed this conversation as much as I did, and we've learned a lot about you, Dr. Molina, so thank you. I want to thank all our participants who tuned in this evening. If you're interested in learning more about our organization or becoming a member, you can find us at LatinoSurgicalSociety.org and on various social media channels at Latino Surgery. And the recording for this event will be on our YouTube channel shortly. Buenas noches a todos y muchas gracias.
Buenas noches.
Buenas noches.